The electricity in the frontal lobe is highly electrical. So now what brain tissue, this can lead to brain fog, and when I see it light up yellow, it's usually heavy metals that enter into the brain. Mercury, lead, cadmium. So I'm going to look at their teeth, see if they have any fillings. Where's their mercury coming from? Is it a vaccine? Is it fish? And you know what metals are actually there. This machine will tell me. Mm-hmm. So this is just telling me there's a problem in the brain. Hydration and more again real salt and real salt for the sodium potassium pumps.
Well, I'm sure she.
So this woman's 48% total water.
Yeah, she's very dehydrated.
Wow.
So and she wasn't drinking enough water.
Yeah.
So just dehydration alone can cause a lot of complications. I'm finding the intestines. So now see her blood, it's thick. So she's got thick blood, which is going to cause what? See the orange? Mm-hmm. And see the femoral is orange. So that's thick blood. Now you're going to have trouble with circulation to the hands and the feet. So cold hands and cold feet. I do my own formulas.
Mm-hmm. What does it do to pick up the chemtrails, or what do you see?
We pick it up on the second scan. It actually picks up, and in fact it prints chem vapor trails biological warfare experiments. It actually prints that.
Tells you that?
Right in the scan. Yeah. And we're picking up malathion, ethylene dibromide, barium salts. To walk inside any body part I want to. So it does your heart, your lungs, your liver, your kidneys, your intestine. So if I want to see her heart, see she's a mess. See all that yellow?
The yellow is?
That's plaque starting and inflammation. So she's got problems in her inferior vena cava, which is leading to legs, and she had edema. Low body composition. I mean, she needs to gain weight, not lose weight. Tissue inflammation is the yellow here. So I use a lot of anti-inflammatories like MSM, turmeric, ginger, quercetin, bromelain, combinations of to reduce inflammation in this patient. Can come from this.
Tingling?
Yeah, tingling, neuropathy, neuritis can manifest from that. Junk in the trunk, we got to clean up the intestines, yellow. So I use an oxytox. In fact, Ed's is one of the best as far as the oxy powder.
Sure. Yeah.
And then acid reflux. And this patient had some GERD problems, acid reflux. See that pipe right there, yellow? That's the esophageal, and then it's connected to the stomach pots. So whatever she's drinking or eating is lighting up the stomach to yellow. And that's a coffee drinker. I always catch them. It's like, how much coffee are you drinking? Are you a sweet eater? Are you an alcohol drinker at night? And that usually is the parameters that will show that. And then how we thin the blood, dietary change, no mucus, sticky foods. So we get them off the cheese, the bread, the pasta, the pizza, the fried foods, the canned foods, and put them on fruit. You could follow that nerve right into the intestines, which is a peristalsis shutdown, which is constipation. So you could be constipated, and a gastrointestinal specialist will never look at your lumbar, your lower back. No concept. And then also too, it does a blood profile. Now there's critters in this patient here, but I don't know what that is yet, the species, until I run the other scan. The other scan will tell me what's in the blood. Is it parasite? Is it fungus? Is it candida? Spores? And then see, she's sedentary, and that's how I knew. See, red, level of activity, she's sitting in the chair all the time. And brain, again, brain fog, tissue inflammation, see her stress, orange, and her nervous system. So